Good afternoon. My name is Dr. Joan Reed. I'm Dean for Diversity and Community Partnership and Professor of Medicine at Harvard Medical School. And thank you for joining us. There are over 250 registrants for our discussion today on internal medicine residency programs. This includes students, faculty, and administrators from across many schools and organizations. Today's webinar is sponsored by the Harvard Medical School Office for Diversity, Inclusion, and Community Partnership, otherwise known as DICP. The mission of DICP is to advance diversity and inclusion in health, biomedical, behavioral, and STEM fields in ways that build individual and institutional capacity to achieve excellence, foster innovation, and ensure equity in health locally, nationally, and globally. DICP efforts support the career development of junior faculty, trainees, and students, identifies and trains leaders in academic medicine and health policy, and provides programs that address crucial pipeline issues. Today's program is the second webinar in our 2021 Visiting Clerkship Program webinar series. For 30 years, the VCP, Visiting Clerkship Program, has been a model of excellence, offering outstanding medical students, particularly those from groups underrepresented in medicine, an opportunity to participate in externships at Harvard Medical School and its affiliated hospitals. Since inception, more than 1,500 students have rotated through the VCP. VCP has been drastically impacted by COVID-19, and we recognize that there is a lot of uncertainty about what may be coming up in the application cycle. With this concern in mind, we're hosting a series of webinars to bring members of our Harvard Medical School residency programs and medical students together to share ideas, provide support, and address questions on transitioning to the next stage of medical training. These webinars provide an opportunity to discuss the application process, address questions from students regarding away rotations, as well as concerns that students might have. A few housekeeping notes as we begin today's session. The chat is not available. Your microphones will be muted, but you can use the question and answer to post questions for panelists. The webinar is being recorded and will be posted on the DICP website. It's now my pleasure to introduce Dr. Alden Landry. Dr. Landry is an emergency medicine physician at Beth Israel Deaconess Medical Center, and assistant professor of emergency medicine at Harvard Medical School and assistant dean in the Office for Diversity, Inclusion, and Community Partnership. Now I'd like to turn this over to Dr. Landry.
Thank you, Dr. Reed, for the introduction, and thank you to all of those in attendance today, and a very special thank you to our panelists for being here. I'm excited about continuing this line of conversations around applying to residencies here at the Harvard affiliated hospitals, and we're starting off with an amazing group of panelists for our internal medicine discussion. These are all 5 amazing program directors who have been integral in the recruitment of trainees from diverse backgrounds for years, and they're all friends of the Visiting Clerkship Program. So I want to just say thank you for being here today. I'm going to go very quickly through an introduction of our program directors, because I want to give them time to introduce their program to you before we get into our questions in this conversation. Just following up on what Dr. Reed said, the chat is closed, but if you do have questions for our program directors, be sure to put those in the Q&A, and I will try and get to as many of those questions as possible. We know there's a lot of questions that are out there that you may have in regards to this, again, atypical application and interview season. We're going to try and make sure we answer all of those questions as best as possible. But in the meantime, let me introduce the panelists, and then they can tell you a little bit about their programs, and then we'll jump into the questions for the program directors. So first, I want to introduce Dr. Joel Katz, who is the program director for the Brigham and Women's Hospital Internal Medicine Residency Program. We also have Dr. Chris Smith, who is the program director for the Internal Medicine Residency Program at Beth Israel Deaconess Medical Center. We have Dr. Jayton Bias, who is the program director for the Internal Medicine Residency Director Program at Massachusetts General Hospital. We also have Dr. Shiv Shera, who is the Internal Medicine Program Director for Mount Auburn Hospital. And last but certainly not least is Dr. Rachel Stark, who is the Internal Medicine Residency Program Director for Cambridge Health Alliance. And with that, I will turn it over to our program directors. And I believe Dr. Katz, you are up first. Can you just give us a quick overview of your program and what makes it awesome and unique?
Thank you very much. And I want to, just before I do that, say a couple of points. First one is Dr. Reed and Dr. Landry are superstars. They're all stars. They make this visiting clerkship program and the environment at Harvard so welcoming to all trainees at all levels from all backgrounds. And although many of you won't be able to come here immediately, you should have confidence that if you do decide to come to any of the Harvard-based training programs, you will have true friends and family at the medical school with Drs. Landry and Reed, and others. And second, I just want to acknowledge all the work that you, the applicants, have put in this year during COVID. It has been the most unusual year of my career, year and a half. And you as students, wherever you've been, I know you probably feel like your training's been disrupted. And I think there will be lessons to learn in the future that are really hard to appreciate right now. This is a, career-changing pandemic, and even if you've missed major parts of your clerkship, we will train you well. Wherever you end up, we're prepared to make the best out of that. And then finally, I just want to say how honored I am to be on with this incredible panel of other program directors. These are my people. These are the people I love and adore. It was a hard decision when I was in medical school to decide to do internal medicine. I was debating between pediatrics and medicine. This was pre-med peds. And I have to say, when I picked internal medicine, it felt right, and it has felt right the entire time. And I'm not going to give you my full biography, but I'll say that I wandered into many directions, which internal medicine allows you to do: clinical, research, administrative, education. And it's just a uniquely wonderful career for people who are multifaceted. So with that preamble, you can see a picture of the hospital here. We have a categorical, 2 primary care, med peds, and preliminary programs. The total number of interns per year in all of those programs is about 70, most of which are in the categorical program. One of the wonderful features is that, as you can see in this picture, we are right next to Harvard Medical School. This is the old Peter Bent Brigham Hospital and the Harvard Medical School, built together between 1905 and 1912. And that close proximity to Harvard is one of the many positive things. We are, like all of the residencies being represented here today, very rich. We have a wonderful faculty, great reserve, great resources available through the Boston Harvard MIT system that our residents can access. There are great training opportunities that allow you to be both independent and push your limits, and fabulous faculty who are dedicated to you and residents right on site for you. A couple of our particular focuses that might be relevant to you is in the areas of diversity and equity and inclusion. On the right-hand side, you can see some of our residents protesting after George Floyd's murder. And then I'm not going to go into too many details, but we have opportunities for deep individualized career development after you've mastered balancing potassium through your clinical training in areas of medical education, biomedical science, global health equity, etc., which I'd be happy to talk about. I welcome you all, and I look forward to your questions.
Thank you for that, Dr. Katz. All right, and next we will have Dr. Shera talk about the Mount Auburn Hospital Residency Program.
Dr. Reed, Dr. Landry, thank you for having us here. And I echo Dr. Katz's wonderful preamble. I'll just start off by saying I'm a former Mount Auburn intern and resident. So you'll probably see my love for the program in the brief 1 or 2 minute introduction that I'll give about us. So we are coming up to about 50 years of having an internal medicine residency program at the Mount. We are a community teaching hospital. We in all have 14 categorical interns that we interview for every year. We are very proud of the individualized training we're able to provide our interns and residents. So if you're interested in primary care, hospitalist medicine, or fellowships, we have separate pathways with a slightly different structure for the program, and great individualized mentorship for all the pathways. So our program is on an X+Y structure. So we have folks doing 4 weeks of inpatient followed by 1 week of outpatient. We consider ourselves to be a stellar program, and we'd love for you to apply to us.
Thank you for telling us about the Mount Auburn program. Next is Dr. Smith at Beth Israel Deaconess Medical Center.
Thank you, Alden, and thank you, Dean Reed, for, again, being such wonderful supporters of all of our residents across the Harvard system. And, you know, I didn't come from the Harvard system originally. I went to medical school elsewhere in a totally different part of the country. And I was very fortunate to come here for my internship and residency. And I initially had some concerns about coming to Harvard. I really wasn't sure what it was going to be like to come here. And that was 25 years ago. And the reason I have stayed here is because it is a remarkably warm and supportive place to be. And I hope that you get a chance to experience that as well, because I find it to be just one of the best places that I can imagine. And I feel like as a program director, I have the best job in the world. I get to spend time with students and residents who are just amazing and lift me up. And when I think about, you know, having a minute to share with you about our program, I really wanted to highlight our culture, because I find that most residency programs I'd be applying to are more similar than they are different. And at the end of the day, you really are looking a little bit about what distinguishes them and what makes their culture different. And one thing that we always put very upfront in of every applicant and every resident here is that here patients come first. And we have an extraordinarily diverse patient population, and we value having diverse residents in our program to help take care of those patients. And my playbook is very simple. I want residents that you would feel comfortable caring for your loved ones. I want residents who are going to support each other and lift each other up inside the hospital and outside. And that's the forefront of what we're trying to do. Our job as program directors after that is to then surround you with the resources you need to excel, to maintain a sense of wellness throughout that. But as Dr. Katz was mentioning, opportunity beyond the potassium level to then grow in areas like global health, social justice track and pathway, the clinician educator track, physician scientist pathway. Because at the end of the day, what our real goal is to develop leaders in internal medicine. And I care less exactly what that is, but that you're going to go out and be a leader in whatever field you choose. And I look forward to the opportunity to talk with you more and get to meet you in the fall as you interview. Thank you.
Thank you, Dr. Smith. Next up is Dr. Stark.
Thank you so much, Dr. Landry and Dr. Reed. And I echo the warmth and gratitude certainly shared by my program director colleagues on the call today. I'm the program director at Cambridge Health Alliance, and we serve sort of a different kind of niche within the Harvard Training Consortium here. We are a smaller program at a community-based Harvard-affiliated program with a real focus on generalist career pathways, primary care, and many of our residents also go into hospitalist medicine. But we're a total of 24 trainees in the program, 8 interns per year. And we are also a public hospital system in Massachusetts. So we serve a special population of patients, many of them vulnerable, underserved, from diverse backgrounds, and many of them first-generation immigrants to the US. So opportunities to really care for a diverse patient population, opportunities to use languages other than English if you speak them, opportunities to access equitable care for patients across the continuum, regardless of background. We're also the public health department for the city of Cambridge, which gives us sort of a unique opportunity to think about individual health and also the health of the public that we care for across a couple of hospitals in our catchment area and 15 outpatient practices, and three of which are core training sites for our residents. We have a real emphasis on social medicine and physician advocacy in our program, and there's been sort of a long history of such. not with sort of with dedicated programming that goes throughout the course of our training program. And I encourage you to learn more about us by checking out our website, checking out our Twitter and Instagram if you're a social media person, but really sort of for those of you who are interested in generalist pathways in internal medicine, we'd love to hear more from you, love to meet you, and sort of echo also the other comments from the other program directors here that this is a warm and welcoming and supportive environment for people to learn and grow and develop into future physician leaders.
Wonderful. Thank you for that, Dr. Stark. And last is going to be Dr. Bias from MGH.
Thank you, Dr. Landry and Dr. Reed. I'm delighted to be here and to join my friends in talking to the students here with the VCP program, which is obviously near and dear to all of our hearts. I represent the Mass General Hospital. We are a mission-driven institution that is focused on patient care, research, education, and community outreach. And we take all four of those pillars very solemnly. And our residency program is really a microcosm of our institution. One of the things I really love about our program is the collegiality and the opportunity for residents to support each other. I'll echo a little bit of what you've heard before. I think that each one of these programs has a slightly different personality. You're going to find them to be more the same than they are different. But the goal really, I think, is you're looking and exploring these programs is really to try to find out which one you feel most at home at. And I will just say that, no matter where you choose to do residency, it's hard, but it's made a little bit less hard when you're working with your very best friends. And so one of the things that I love to see is how residents work with each other, learn from each other, care for patients with each other, and really try to advance not only their knowledge, but really in terms of the service of patients, and as well as expanding diversity and pushing on on what we have learned in the labs and what we've learned in research, and now applying that into the areas of clinical medicine. One of the things we want to preserve as you go through your education is really that idea of intellectual curiosity, and ensuring that you're continuing to ask the question why. Why is it that these two patients look very different? Why is it that we have ongoing barriers to high quality care? And using those questions to be the agent of change that we know you as future leaders of American medicine will be. So I look forward to the rest of this session and answering your specific questions.
Thank you to all the program directors for your overview of the programs. And I just hope that the audience can appreciate how each program across the institutions are unique. However, they are all amazing training opportunities. And I think really the goal for this session and for the homework that you all have to do is to figure out which of these programs will offer you the best space to grow into the physician that you hope to become. And thank you, Dr. Katz, for the comment about potassium. I'm glad as an ED doc, I didn't have to make the comment about it to my internal medicine colleagues. All right, so I actually want to just go through with some really general questions to have this conversation and to get you all to start thinking about, and I say you all, I mean to the students, thinking about how we are processing this interview season, what we're thinking about from an institutional standpoint, and what you may be thinking about from a applicant standpoint. So my first question is really just hopefully going to turn to you, Chris, and just to offer us an overview of this timeline for the application season and what's different this year compared to prior. Can you just give us a heads up on what's happening this year?
Yeah, so thank you, Alvin. So the match came out recently and announced the dates for this coming year, and you can find them online. I can forward this if anybody's interested, but things changed from 2 years ago to last year to this year just a little bit. This year, the information will be available to the folks on this call, the residency program directors, will be available on October 1st. September 15th, the registration for the match opens up, but October 1st is when the programs will receive all that information, which is hopefully your entire packet of application. most programs, I'm going to guess, will take a couple weeks to review those applications. And somewhere along the line of the second half of October, you'll probably begin to receive invitations from to interview. And most interviews, I'm going to guess, will happen November, December, and probably the first 2 weeks of January is probably what I'm thinking that most interviews will happen this year. Last year, everything was moved back a little bit later. The whole process started later to allow students time to complete their sub-Is and other rotations, get the letters they needed. But it's been pushed back a little bit to closer to the original time from 2 years ago, with the information we released October 1st. Expect invitations to happen probably the second half of October, interviews November, December, some in January, and then match day will be March 18th this year. So it will actually happen pretty quickly, surprisingly quickly. Alden, I lost.
Yeah, I can't hear you, Alden.
Can you hear me now?
Yeah.
Of course we would have an IT issue. So one of the questions I have for you, Chris, is if you could just clarify for me one thing about the timing of when the dean's letters will go out, or the MSPE, and how that relates to when the applications are going to be available.
Yeah, so my understanding is that in the past, the application was made available in September, and the dean's letter oftentimes came out around the beginning of October, October 1st. This year, my understanding is that those are both going to happen at the same time. So the entire application and dean's letters all going to be opened up to the programs at the same time, which would be October 1st. So the real deadline and getting everything into the application ready to be rolled out is October 1st. And I think most programs will usually set their deadlines for the materials to be due around that same October 1st. Each program is a little bit different, but I suspect it'll be close to that October 1st deadline.
Wonderful. And Rachel, given that we're having these changes, how are you preparing for this application season as a program director?
Thanks, Dr. Landry. I think I think our preparation this year is going to be very similar to preparation in years past, sort of with awareness of timelines, like you heard from Dr. Smith. I think what last year's application cycle taught all of us, and I will speak for my colleagues boldly on this, is that flexibility and ingenuity and trusting that all things will work out were sort of the order of the day in the last application cycle. And I think actually, I know that I certainly learned a lot about what we were capable of, what we were capable of communicating, how students could be flexible, how all of internal medicine residency interviewing could happen online across the entire country. And then that could still lead to an incredibly successful match on the side of programs and on the side of students. So I think the jury is still out for most programs about how they're going to handle in-person or virtual interviewing, or some combination of both. And I expect that there will be much more clarity around that as summer approaches. I certainly know we're trying to investigate or think through, but I would expect that most programs, if they are not doing an all virtual platform, they will have some type of virtual platform. And we also recognize that at this point, any students who are in the application cycle for this season have had some aspect of their medical education and their clinical education disrupted, or at least atypical from what we expected in pre-pandemic times. And please know that we handled that as a program director community, and of course would not penalize students for that. And similarly, we will handle the same in this application cycle, recognizing that that everybody's circumstances are individualized, either school, personal, and experiences through the pandemic that would affect application season and what the application might look like this year.
Great, and thank you for that, because I think it gives us an understanding that you know, we all don't have our ducks in a row just yet. We're still trying to figure things out as the system evolves and as we hear more about what's opening and what's not, how different states may allow different aspects as far as travel and in-person gatherings. So there's a lot of complicating factors that are going into this, and it's not just on the students to figure this out. We too, as the programs, are trying to figure out how this all works. And so, Joel, I want to go to you. Given the uncertainty about the upcoming application season, what are your recommendations for students going into this process?
Thank you very much. So I would say my number one recommendation is to be prepared. Take your time to be prepared. Even though the applications are going to be released a little bit later, that is not licensed to procrastinate. And so for the students, number one is get your application material together in a timely fashion. Programs have deadlines, and it's up to you to meet those deadlines. I agree with Rachel's interpretation that there will probably be some combination of hybrid versus in-person versus only virtual. I think it's going to depend a lot on different states, as mentioned, and also whether institutions are public or private institutions. But that puts the burden on you as the applicant to do your homework and to try and learn about the programs in alternative ways if you're not able to visit. Websites are a good way to do that. Reaching out to students from your institution who are at these institutions for a personal connection is a good idea. Graduates of these institutions who are at your institution now are a good way to connect. So I would try and use your time to check the facts, learn about the programs, do your homework. And then the last thing I would say is last year we noticed that because it was virtual, people applied to many more programs than they had in prior years. We had our applications, I think, were up about 10%, and that was typical of other places. But I would encourage you not to apply to too many places. It's exhausting, and you really can't focus on and get to know the programs in the depth that you want to if you're applying to so many programs. What that exact number is depends a lot on your own medical school, your performance, your specialty you're applying in, and your deans and your faculty advisors at your institutions can help you with that decision. Yeah, I think that's it. And I wouldn't put the brakes on the rest of your education. It's really important to do other electives outside your specialty. A few of you haven't yet solidified which field you're applying into. This is a good time to do that in the next couple of months. I don't encourage applying to more than one field, but it can be done technically. My advice is to what my wife gave me this advice. She told me, I was debating between medicine and pediatrics, and she said, I want you to go take a walk and don't come back until you decide. I'm sick and tired of listening to you complain. And I did that, and some method to figure out what you want to do. That's the time now. And I would say, I would recommend you block either December or January to do interviews, because that's when most of the interviews occur. In some specialties that are more competitive, you might need to block both months.
And thank you for that advice. It's really interesting because as we're dealing with students who had their medical education interrupted, as all students did, rotations may have been canceled, or they've been online, or they were deferred until later. And there's a lot of students who are going through this process with maybe a question of it may be this and maybe another subspecialty. So I think it's important for you to really think about how sincere you are, how interested you are about a specialty in order to make the best decision for you. So thank you for that.
Let me just give one tip on that, is that there are people inevitably who are either not sure which field they want to go into, or maybe are applying in a competitive field but have to have a backup field. That's okay, it happens. But ask your letter writers to write residency and not specify the field you're applying into. There's no bigger turn than getting a letter of recommendation where the wrong specialty is written into the letter of recommendation. And when I write letters of recommendation, I always say, this applicant is applying to your residency program without specifying.
Yeah, thank you for that. And we'll talk a little bit more about letters of recommendation later on. So the VCP, our bread and butter, was visiting clerkship program, getting students here on campus so they can have the experience of being in our hospitals. Obviously, this has been severely altered because of COVID. Last year, we weren't able to bring students on. And so I wanted to focus our next couple of questions on away rotations. And I want to turn to you, Jathan. A number of students are interested in doing away rotations, but it's a relatively narrow window for students to do so. How will away rotations be viewed this application season?
It's a good question, Alden, and I'll say that, you know, last year obviously we had as you mentioned, the program was not in place, and that was consistent with what was going on around the country, and so we really didn't have an opportunity to see a number of students kind of operate in different environments. And yet I think we're able to successfully be able to kind of evaluate and look at and recruit really wonderful residents. In this situation, we're going to, as things are opening up, and things are not opening up in a uniform basis. So around the country, there's different dates in terms of when things are opening up. And so being able to, you know, we're going to be opening up, but it's going to be, like you said, a relatively small window. And so I don't think any of us on this call would want to, we would want to see those, treat the people who are able to get in to those any differently than those who are not. And essentially it'd be like looking at lottery winners and saying that just because you won the lottery that you're going to be treated in a slightly different way. I think there's wonderful ways by which you can continue to excel and shine, both at your own at your home institution, as well as if you want to do something else somewhere else and you're able to do it. But we don't see that away rotation as pivotal. And I do recognize in other fields that tends to be something that is really seen as kind of the make or break. I guess I would say in internal medicine, that's not the case for us.
Thank you for that. And just want to turn to you, Shiv. Jathan started to lead into this discussion, and I want you to continue in on the discussion. If a student isn't able to secure a rotation, what should they be doing right now? How can they make sure that they're shining or excelling at their home institution?
Thank you, Alden. So I'll build upon a little bit of Jay's comments that you know, everyone's in the same boat. There are probably many students who won't be able to secure away rotations. And as Jay said, we as medicine programs don't look at it as a make or break. My recommendation would be try and focus on what you're doing. Try and do the best you can in your own rotations in your own school and try and get the best experience out of that. And do as well as you can, and don't worry much about the away rotations this year.
Thank you. And then last, just closing the discussion around away rotations, Chris, how will students who are unable to do away rotations be compared to students who did? And I think Dr. Vyasar already started to allude to this answer.
Yeah, no, Jay, I think it was right on the money. I don't think that anybody would hold somebody in a more or lesser light, whether they get to do a rotation or not get to do a rotation. And I think it's fortunate that internal medicine doing away rotations has really not been a huge part of the formula for getting an opportunity to either get an interview or how one is ranked eventually. So I really am not seeing this as being a big factor. I think everybody's in the same boat. And if you don't get to do an away rotation, I certainly don't think anybody's going to hold that against you.
Great. And, you know, one of the things that we prided ourselves on as part of the visiting clerkship program is students were able to come to our campus, get to see us, experience our hospitals, experience Boston and Cambridge, get to know our communities as they were in the process of preparing for season. We have a lot of students who are really interested in our programs, Rachel. If a student has a particular interest in a program, specifically in this space before the application goes out, how should they go about letting a program know about their interest?
So great question. I think certainly if you're interested in my program, I'd love to hear from you. Lots of people reached out last season as well, and given it being an alternative year, we get these kinds of emails all of the time, and happy to hear from you, happy to answer questions to the extent that we can. And often really happy to help facilitate networking so that we can connect you with residents who might have similar interests or similar backgrounds, or residents who might have gone to your same medical school who can give you sort of their experience in sort of living in our communities and training in our hospitals. Sometimes if you're interested in a particular type of research project or an area of academic interest, we can connect you to other colleagues who are doing that work. So I would use it as an opportunity, not necessarily to check in and ask specific questions about the residency program that you might be able to find on the website, because many of our websites actually have lots of nitty-gritty details. But if there are things that that we can sort of help direct you to that would influence your decision for a formal application at our program, please reach out. This should feel like a humane process. I know it feels really, really scary. And I just want to highlight that we are all really nice people, and we are all people who are really dedicated to mentorship and growth and development of students and residents and folks in their early careers in internal medicine and beyond. Otherwise, we would not be in these jobs. This is the stuff that really gets us and wakes us up in the morning and gives us value in the work that we do. So we want to support students who are interested in our field, and we want to support students who are interested in our training programs. And I think more often than not, you'll find you're met with generosity on the other side.
Yeah, I just want to say thank you for humanizing this process, because I think we often think about this as such a rigid, cold, isolating process, and it's not. There's thousands of medical students across the country who are going through this, and thousands of programs that are going through this, and so we're all in this boat together. And so thank you for bringing back the human component to this. Joel, just wanted to turn to you for another question building upon this. We often talk about how to communicate and who to communicate with. We often think, oh, go to the program director, but they may not necessarily be the one that's most easily accessible. Is there value in reaching out to current residents in the program, or maybe other faculty who are at the facility?
Yes, absolutely. I think using all of your resources is a great idea. I think honestly, the program directors sometimes are the busiest, so they're not necessarily the best resources. Often they'll do what Rachel just mentioned, which is to connect you to someone else who can address your concerns or questions more closely. I think the best resources are the residents themselves. They have their hand on the pulse. They will be close to your experience as a medical student. And so I think they are probably your best resource. Faculty can be helpful, particularly people who you have a connection to, either career-wise or personal or training overlap. And then, as I mentioned, the one that we don't think about are people who trained at these programs and are now on faculty at your institution or practicing in your town. Is a great, can be a great resource. I would say one of the advantages, if you will, of virtual interviewing is you can reach out to people anywhere around the country, graduates of our program, graduates of your program who have that personal connection.
Yeah, just to double down, this is a perfect time to start those networking and getting more information and thinking about programs, especially as you think about longitudinally what your career you want it to look like. And you make a great point about identifying folks who are at your current medical school, who may be from other places. So you have to give you a broader perspective of what training was like elsewhere, and then also what the experience is like at your current institution. So thank you for that. Next, we're going to talk a little bit about preparing the application. So Jay, how can students overcome a poor performance, whether it be a poor performance during a core clerkship, or maybe not the best step one score that they could have gotten for when taking the exam?
It's a good question, Alden. And I think that, oftentimes when we're looking at these applications, we're really focused not on a single value or a single grade, but we're actually trying to look at this kind of in the whole total scope of the application. The other part of the application I think that is worth emphasizing is what the trajectory has been. So if you see that someone has had, let's say, a weaker clerkship experience, but that was their first clerkship, and then as they started to get used to the clerkships, they were getting better and better, that trajectory is oftentimes particularly helpful. In many of these situations, there may be some very compelling reason for why that happened, a family urgency or a family emergency or some other illness that may have happened. We cannot tell unless you want to share that. And I'm not saying that you have to share that, but if there is a backstory to a bad grade or a bad rotation, then the personal statement is an opportunity to be able to kind of share some of that information with us. We're all human. We've all gone through, both our ups and downs. And so what we want to be able to make sure is that we're recognizing what were the circumstances around that particular event that may provide some context into that. And so again, I would say the whole thing is that we're looking at this in context. We're looking at it in terms of your progression through medical school. And if there's something specific that happened around that and you're willing to share it, please share it with us.
Great. Thank you for that. And I think just to continue with that point of, this life happens while you're in medical school. And so if you have ups and downs, we completely understand that. And in addition to the personal statement, another place you may want to consider sort of that explanation as to a bad outcome or a bad sort of rough patch during your medical education is actually how you can engage your letter writers as someone who could be someone who supports you and puts that commentary there. So just staying with you, Jay, any thoughts about maybe asking a letter writer to help you add that commentary about a rough patch in your career?
I think it's a wonderful idea because, you know, when surrogates are speaking for you and they can provide some additional perspective, I think that becomes particularly powerful. I will just share, you know, I remember doing a rotation kind of and I think it was probably in one of my poorest grades, but my father had a heart attack in India and had to come back to the United States and undergo bypass surgery. It was hard during that time to be able to focus on the ins and outs of that clerkship. And so, you know, I just want to use that as a personal example of like how these things can happen. But your idea to also to have surrogates speak for you on that behalf, because many people who are close to me knew about that, I think really does carry a powerful voice.
Thank you. And Shiv, turning to you, these students are fortunate that they don't have to worry about step 2 CS, the clinical skills portion of the USMLE is gone, but there is still step 2 CK. And so what should students be doing or should a student be worried about taking step 2 prior to getting their application done? And if so, how will that impact their application?
So Alden, I think when I say this, I speak for all the internal medicine programs here that it's absolutely okay to apply without your step 2 score and without having taken step 2, as long as you have a plan of taking it within a reasonable time frame. So, you know, programs are able to re-download applications. We can look at applications again more towards the match and see if the step 2 has been completed and what the scores are. I'll introduce the term holistic review of applications, and you may hear this again later on in the next 30 minutes or so. All programs, I believe, here conduct a holistic review of applications. So, you know, we look at the score, we look at everything else within the application, we look at your personal statement before deciding who to invite for an interview. So in short, it's probably absolutely okay to apply without having taken step 2.
Thank you. And Chris, another huge part of the application is the personal statement. We've all been impacted by COVID. Is there any thoughts about how to include a conversation around COVID, or should students sort of move on and not necessarily put that in a personal statement? Or what are you looking for in a good personal statement?
Yeah, you know, I think of the personal statement really as a chance to tell your story. To tell what excites you and what you're passionate about. Now, certainly part of the personal statement should be about why you're passionate about internal medicine, but it gives you an opportunity sometimes to do as Jay said, to maybe highlight why something didn't go right on a rotation, because as Rachel was saying, we're all kind, compassionate people, and if there's a reason for it, we're going to understand, and we'd love to help you through that. But it's a chance also to take this sometimes confusing, nebulous CV and tie it together, to tell a story about who you are, what excites you, what you're passionate about, what you want to do with your career. And I say that what you're doing with your career, but I'll also say nobody expects you to have a really clear plan beyond internal medicine. If you know that you want to do infectious diseases or cardiology, that's great to talk about that. And if your career trajectory has been along that pathway, you've done research in that area, and you want to let that shine, that's great. But you don't, at this level, need to have that that sort of detail in your personal statement about exactly where you're going with your career. But do use it as a chance to highlight what's most important to you, who you are, what you're passionate about, and if there are any opportunities to explain things that need to be explained, this is a chance to do it along the way as well. I would also say most personal statements can help you. I find it rare that a personal statement hurts you. But I would encourage you to have many people read your personal statement. Have your advisors, your mentors, loved ones read it, check it, double check it to make sure it's as clear and grammatically correct as it can possibly be.
Yeah, it's you know, we're in medicine, and we some of us, a lot of us, most of us can be very type A. And it's very easy to look at a personal statement and see something that's phrased wrong or some misspelling and sort of get fixated on this. And the last thing you want to do is something that's easily correctable as either a spelling issue or grammar be something that sort of rubs an interviewer, or excuse me, rubs a reviewer the wrong way. Not to say that we're going to be looking at your applications and your personal statements with that level of detail, but make sure you put your best foot forward, I think is what I want to say. And then Rachel, something else that's really important, were letters of recommendation. Can you talk about letters of recommendation, specifically what students should look for in a letter writer? And then also what they can do to help their letter writer put down the best comments in that letter.
Yeah, sure. So I think the best letters are clearly written by faculty who know you well. And that may or may not be the faculty who is the attending on your 1 week rotation on the cardiology service. It might be somebody you spent a year in a clinic with. It might be somebody who you developed a deep relationship with in a research project. It might be any number of people who have occupied your life during residency. I think the most important thing though is that they really know you and can speak to a narrative about you, which might include something about issues in performance if that is relevant, but mostly it should speak to sort of your character. We know things about you in terms of your grades and achievements by reading your CV and by reading your USMLE score reports and things like that. And your transcript, right? We want to know you as a person and how people value you and what kind of comportment you have and what you bring to a learning community and a learning environment. And that's not the stuff that we can get from your transcript. And it's a little bit of what we can get from the MISP, but the letter really sort of speaks to, again, kind of coming back to that same theme, sort of the humanness of you and your application. So I think really important to select letter writers who can write strong letters about you because they know you and they've had experience with you. And if you're thinking about multiple letter writers, it's helpful to have people who have experienced you and your work in different kinds of aspects of your training. So it could be someone you worked on an inpatient rotation with, someone on an outpatient rotation with, someone who you did research with, and it sort of gives us as the people who are looking at your application sort of a 360-degree view of your work with lots of folks. I think it's really important to ask your letter writers if they feel they can write a strong and personal letter for you, and often to sort of set them up with, maybe meet with them and talk about things that might be helpful to be included in the letter. The one thing that I'll say when reviewing thousands and thousands of applications over the years are, the folks who write a letter for somebody, you chose a letter writer that wrote you like a 4-sentence paragraph. I worry about those students, right? Really spend some time thinking about it. And if you're not sure as you prepare the application, talk to your deans, talk to other mentors that you've worked with and sort of say, I'm thinking about asking, these 2 or 3 folks, does that sound like it would sort of put my best foot forward in terms of a well-rounded application?
Thank you. And I think there's something to be said about asking the most senior person to write your letter may not always be the best person because they may not know you. Asking the person who you have a relationship with, who is faculty, but you have a good relationship with, can really speak to that personal side of things that you're talking about, Rachel. So be specific in how you target your letter writers. Joel, I want to turn and talk about the interview process. Our colleagues in OBGYN have already committed to virtual interviews this season. Do you think internal medicine programs will do the same or similar?
I don't think it's been finalized, but I think the vast majority of programs will do all or most interviews virtually this year. Our fellowship match is a little bit ahead of the residency match, and most of the fellowships have committed to virtual interviews as well. I think the piece that hasn't been decided is, will there be an option for programs who are interested in states where it's safe and allowed for them to supplement virtual interviews with in-person visits? I think that is to be determined. but I suspect few and far between.
Yeah, and I think the reality is we aren't sure yet. We're still trying to figure out what's going to happen, and so I would anticipate that students should be more prepared for the virtual aspect this year, but there may be a chance for an in-person. With that, Jay, if we're preparing for the virtual space for interviews, how do you advise students to make sure that they are prepared to do their best in a virtual interview? And I would love to hear what your experiences were last year and having gone through the virtual interview season.
So, I think there's a lot of things that still hold true with virtual interviews as they do with interviews. And I think the goal is that you want to show enthusiasm for the program and you want to show your interest in the program, and that can be done both in person and virtually. I will say part of this is a little bit of stage presence. So, right now I'm looking into the camera right now, but if I were looking down at my computer screen, you would be seeing something like this. And so while this looks perfectly normal to me, this probably looks better to you. And so there's the small tricks and other things that you can do to be helpful. Make sure that you've either your medical school may have an opportunity to do some practice interviews, and if they don't, grab a buddy and just kind of get a sense as to if you're going to be interviewing in this room at certain this time, what's the lighting situation, and those types of things, just to be able to kind of and make sure that you're able to be heard and seen. I think those things are helpful. But at the same time, and then the other difficult part, I think sometimes with a virtual interview, but sometimes in practice, is this kind of time management and knowing how long you're talking and when the interview is going to be over. So you may need to have a situated clock or something else that can be helpful as well. And if it's helpful to those, last year I put together what I'm hoping is going to be my entree to Hollywood and comedy. So I posted on Twitter a little short video, which I will put the link in on in this webinar here, so people can choose to look. So if I'm not the program director next year, that's because I signed on with Brad Pitt to do a movie in the near future. But if that doesn't come through, I will still be the program director in this next upcoming season.
Well, we're all looking forward to your next whatever movie it may be. Don't forget about us little people once you move on to Hollywood. Hey, Shiv, as we have talked about the entire application, everything from learning about programs to applying through the personal statements and letters of recommendation, and we've had a discussion around interviews. But the other end of this, what students are going to be going through in February of this upcoming year, is they're going to be putting together a rank list. And so as students have gone through this process, they've interviewed at programs, what should they be thinking about when they are considering how they create their rank list?
Alden, I'll speak from my time making my rank list here. I thought of two things. First, will this program bring out the best in me? And second, will this program get me where I want to be eventually in my career? And that's how I made my rank list. I think these two things helped me determine the best fit for me. So I think just choosing what program might be the best fit for you that can get you to where you want to be eventually in your career is the best way to make your rank list. The one beautiful thing about the rank list is we don't get to decide, you get to decide, because the match process is favored towards the candidate. So don't think about how a program will rank me, just think about where you want to be, where you'll shine, and that's how you make your rank list.
Thank you. And I think it's really important that we double down on the fact that the rank list is set up to be, to offer the best outcome for the applicant and not necessarily the program. And that may sound weird the way I'm saying it, but the reality is we want to make sure that the residents end up where they would want to be in the rank list. And so it's more important about where you want to be, not necessarily the feedback that you're getting from another program and what they may be offering. I want to open it up to a couple of questions that I think we really need to try and address. And I'll go to you first, Chris, on this question. There's a lot of questions around burnout, stress that trainees are experiencing. How do you as a program support your trainees when it comes to mental health issues, to burnout, and to make sure that trainees are protected during this really stressful time?
You know, Alden, I think that's a great question and a really important one that I would encourage everybody to think about as they go through this interview process. And I think about burnout not as a single fix. It's not about offering a lecture or having somebody available. It really is something I think that all of us think about throughout the design of our programs. It goes into how do we design our call rotations? How do we design time off? How do we create a supportive environment where you feel comfortable coming forward and seeking help if you need help? And there are lots of specific things that we can talk about. We, for example, have a Wellness Wednesday. So days when you're on ambulatory blocks where there's nothing else scheduled, so you can spend time taking care of appointments or other things that you need to do. Shiv, I think, they have a 4+1 schedule during intern year. And I think we all have various schedules. We have a 4+2 schedule, various schedules that are built to help you maintain a sense of balance throughout your year. And that can be sometimes hard to figure out from a website. And I really do think it's important in this situation. I think Alden, you talked about this, talk to recent alumni, talk to people who are in that program now. Whether it's by Zoom or live, talk to the residents about their experiences. How do they feel? How do they seem? Are they enjoying what they're doing? Do they feel supported by the program? And I think that's one of the most important things that you can do to get a better understanding of the culture, the environment, and the people that you're gonna be working with.
Great, thank you. And I want to turn to you, Rachel. There's a question about students who really locked in fairly early about what their career interests are. Maybe it's because they had a great research mentor or they had an experience in the shadowing early on that's really pushing them towards a direction in a specific subspecialty. As they are putting together their application process, let's say their application reads nephrology, they're going to pursue a career in nephrology. How does that play out from your end, and how can they make sure that they aren't overselling their experiences or their interests?
I think that's a great question. I think it goes to sort of, again, sort of aligning what your particular interest or a student's particular interest is with where that program can lift you and sort of put you on a path towards your career goals. And some of that comes from doing your homework and listening to us, for example, on a panel like this, where we've each described a little bit of what makes us different from each other as programs. And again, I'll say the cliche you've heard before, which is in lots of ways we're very, very similar, but in some small ways we're very, very different. So for example, my program is not one where I would recommend students who are interested in interventional cardiology should probably not come to a more primary care oriented public hospital, small community-based program, right? So when students like that apply to my program, I sort of ask them, what are you really looking for in this experience? Are we going to be well aligned? So as you start to look for programs that you want to apply to, I would encourage everybody to do your homework in terms of the vast amount of information that is online. Make your lists, check them with deans and faculty mentors and sort of trusted colleagues. And if you have questions, like we said earlier today, reach out to program directors or chief residents or residents that you might know who were students at your medical school and sort of ask, does this feel right? I don't think that you need to declare your specific love for one small area of subspecialty at this juncture of training. If you absolutely know that and you think that it truly defines you, then great. And there are some people who are very well discerned about what they want to do in the future, and that's okay. And you can sort of declare that. And I think it's important because you're going to want to match in the right training program to make sure that you get to that place. But if you're undifferentiated and you don't know, then really at this juncture of training, it's just about a place that feels like the right fit, where you're going to have the right future opportunities, the right mentorship, the right nurturing to get you where you want to be. The reality is that whether you train at one of these Harvard affiliated programs or elsewhere in an internal medicine training program across the United States, you are going to get wonderful training. You are going to see lots and lots of patients. We all have our niche things that are slightly different, but people get out of training, what they put into it. If they leave with curiosity and engagement, or regardless of whether they want to be a nephrologist or a cardiologist or a generalist or a researcher, that's what they will get in the end. So I wouldn't be so focused on sort of pigeonholing yourself into like it's nephrology or bust unless you're really, really sure that that's what you want. And then if it is, you should sort of approach applications with that lens.
And I think that's a fair point that you presented. And I would really just double down in saying that the program directors are not going to hold you to this. You know, if you say that you're interested in cardiology and you end up deciding that you want to do primary care or hepatology, we're not going to hold you to that. But I think it's really important that you come into it saying that you're genuinely interested in the entire specialty of internal medicine, and you're open to seeing what else could be out there as far as how your career may shape out. And you never know what experiences may happen during residency that may shift you and change your perspective as you go forward. Joel, I have a question for you, and it's about the culture and the climate in Boston. And just any comments about your what your trainees may have told you about how they may have come in with the concept of Boston and how they are experiencing the city now that they're here or after they left.
Yeah, thank you. I hear it all the time. Boston in New England has a great reputation. It's a fabulous town. I love living here. But a lot of people, but it has a bit of a reputation as being a very segregated city and not always as friendly historically as it should have been. In fact, there's some dark sides to the Boston history. When people come here, overwhelmingly, they tell me, or at least what I hear, is how surprised they are, pleasantly surprised, that Boston is in fact a very easy, livable city. It's expensive, but not as expensive as some of our counterpart cities on the East and West Coast. And the things that I hear that are very positive is so many colleges, so many young people, so many great restaurants, nearby outdoors locations, great professional sports, not so good on the college sports, perhaps, or you can get the tickets a little less expensive to college sports because they're not as popular here. And I think that the reputation of it being a segregated city, I won't comment on the truth or not truth of it, but I think it's absolutely navigatable. And if you spend even a short amount of time here, people tell me they find their people, they find their community. And so many of our residents end up staying on here to do fellowship, to enter the faculty. So I would be open-minded. I would ask people who you value their opinion on whether Boston's a good place to live. But overwhelmingly, people have told me that for those expecting great things, it exceeded those expectations, and for those expecting bad things, it didn't turn out to be true, and it was a great place to live.
And the only thing I would add to what you just said, Dr. Katz, is that whether it is something that is structured and established by the hospital or the residency, or something that happens organically, you will find your community here. And I think that's a great comment that I wanted to double down on that you said. The programs are putting in a lot of things to be supportive. The hospitals are. And then there's also just these organic interactions that you will have to help you develop your community and be comfortable while you're spending your time here in Boston.
And I would just add that we define the community as much broader than our own hospitals, and we have lots of events between all the hospitals on this program and within hospitals between the different departments. So I think there is a real recognition of the value of the broader community, not just your residency.
And that's a perfect segue for my question for you, Jay. As we often talk about our hospitals and how we are in silos, and we have, MGH over in Beacon Hill, and then Brigham and MGH Brigham and BI in the Longwood medical area with the Cambridge and Mount Auburn over in Cambridge. But we are a community. And can you talk a little bit about how the hospitals may interact, and also how, someone may come to one residency program for one aspect of their training, but go elsewhere for either their first faculty appointment or for additional training as a fellow?
It's a great point, Alden, and I guess I would emphasize the fact that we are a kind of a community here of graduate medical educators partnered with our undergraduate medical educators at Harvard. A couple things I will note. One is that I think Zoom has made the world a lot smaller. And so one of the things that I think has been wonderful is that there's been a monthly rounds, grand rounds around COVID. Joel has hosted a couple of those that have been really fabulous, that bring speakers not only from around Boston, but pretty much around the world to the Boston community to learn about the latest developments in the COVID pandemic. But it's really been kind of a blueprint on how we can do things in a different space and be able to connect in ways that are really important. Prior to the pandemic, Joel and I have a long tradition of kind of exchanging chiefs for kind of an educational conference. So that happens towards the end of the year, which is really kind of a wonderful thing. And so many of our residents actually communicate back and forth in a regular basis. So it really does create, I think, this kind of wonderful community. We don't see each other as kind of in competition. We all see as each other in terms of lifting each other up and recognizing that as you go through this, that you're part of a wonderfully supportive community that I think that everybody wants to see everyone else succeed. I wanted to just append a little bit to what Joel was talking about in terms of Boston. I too, like Chris, came from a place not in New England. I grew up in Houston, Texas, and then came up to be here in Boston. And when I started to ask questions about Boston, I recognized that I was asking individuals who had spent time in Boston years prior to when I was coming up. And so oftentimes I would just maybe query, as you're asking people about, what life is like in Boston, if they haven't set foot or haven't lived here in the last 20 or 30 years, their view of Boston or the culture within our residency programs may be a bit dated. And so I just would ask you to kind of consider the source as you're getting that type of information, because so much of what I hear is sometimes people come and spend time with us, whether that be in person or virtually, and feel like that they got a different feeling about our program, much more warm and engaging feeling about the Boston healthcare community that wasn't their preconception as they came to spend time in this environment.
It's great to hear, Jay, that you're from Houston. I too am from Texas, and I know Chris is from New Orleans. And so it just to point out, Southerners can't survive in New England. So that's something to be pointed out for those students who are applying from all over the country. Shiv, I have one question for you, and that's really, we've talked about what it's like to get into, or how to get into residency here, but I guess maybe the other side of this discussion is, how do you prepare people to leave your institution to launch into their career, whether it's fellowship or to their first opportunities? And so can you talk a little bit about what it's like to prepare a trainee to launch to that next step?
Alden, that's a great question. I think that training on how to leave residency starts from day one of internship. Our job as supervisors, as trainers, is to prepare you for life after residency. So, individual mentoring, strong advisorship, getting you hooked up with people who have careers like the type of career you would want, is what we start very early on in internship. And I think those are most important in helping our residents be successful after residency. In addition to that, at our program, and I'm sure with other programs, we meet with our residents frequently throughout their 3 years with us, help them decide on their career paths, and help them decide on what might be a good fit for jobs and for fellowships after residency.
Great, thank you for that. And so I want to go ahead and just bring the panel to a close. And again, thank you to our panelists for joining us, to the program directors for being here. And I want to close by doing this. I want each program, if possible, to talk about any pieces of advice that you may have for applicants as we wrap this up. And then also, is there anything else that you think we should have talked about during the past hour that we didn't get to? And so I will go just at random, and I'll go first to you, Jay. Any closing thoughts for this discussion?
I just maybe some practical tips. One is when you're going through the interview trail, spend as much time as you can, whether that be virtually or in person with residents. I think the residents give you the most authentic view of any one of the programs, and so spend a fair amount of time there. The number two one I will just say is I think you're going to learn a lot about yourself through the interview process. So much of those questions are really trying to probe like what you're interested in, and oftentimes up until now you've been trying to figure out like what is my high school physics teacher want? What does my college professor want? What is this this class that I'm taking on pathophysiology in medical school? What do they want from me? We're now starting to ask you the question of what do you want from medicine? And so that's oftentimes a little bit uncomfortable because you've always been working in kind of this kind of external framework. And so I think that that's going to be important, and you're going to learn a lot about yourself. And number three is, again, as a fellow Southerner, fellow Houstonian, give Boston a chance. I think it's just a wonderful, wonderful city, and I couldn't be more happy here.
Awesome. Thank you for that. Joel, I'd like to go to you. Any closing thoughts?
I think Jay, as always, said it beautifully. I would encourage people to go in open-minded, do your own homework, meet with as many residents as you possibly can. Don't over-apply so that the places you actually do interview at, you have time to get to know them. And think broadly about deeply and broadly about your career. Where do you want to be? Not so much in 2 years or 3 years as a resident, but as a faculty member, as a practitioner, as a scholar, whatever it is. Because you're only going to be a resident for 3 years if you do internal medicine. And that's really critically important, 3 years. But what's even more important is where does that lead you? And everybody's different. Everyone is going to look for something different. And I think if you think of programs broadly and think of your future openly, you'll all fall in love with one program. And that is what I wish for each of you, is to fall in love with a program or more.
Thank you for that. Rachel, I'll turn to you.
Sure. I'm going to emphasize again the concept that that training, a lot of what happens in training is what you bring to it, and with the influence of the surrounding culture. So when you look at programs through the lens of who you want to be and where you want to go and what you want to study and the best doctor that you can be, and consider culture and mentorship and sort of, are these the people I want to be up at night on my worst day of residency with? Are these the people who are going to get my back? Are these the people who I want to spend my social time with? Do I feel the energy of this place kind of come alive in me when I am visiting these people and talking to these people? Because the reality is you're still going to be a great doctor on the other side, whether you choose any of our programs or any other programs not represented here, as long as you put effort, enthusiasm, and curiosity into that experience. The other thing that I'll say is that we really, and I'm just highlighting this now because it didn't come up over the course of the conversation today, but as program directors, we really want to meet you. We're really excited about the process of meeting you and learning about you and figuring out whether we can be your next teachers and mentors and career colleagues. And so as much as this process feels really scary and daunting, I just want to encourage you to remember that on the other side are program directors who want to fill their programs with future leaders who are excited about being with us and who are excited to learn in our communities and give back to our patients. So just to try to bring down a notch some of the concern and worry, and highlight again what Jay said, which is this is a time to really think about what you need and who you want to be, and try to drown out the background noise of what everybody has put upon you and land in the place that feels right for you.
Wonderful. Thank you for that. I'll turn to you, Shiv.
So firstly, I'll bring up Boston yet again. So I spent, I think more than 50% of my life has been outside the US, and I've spent time in 6 different US cities. I love Boston. It's a great city to be in, great city to work in, great city to live in, and a great city to train. So we hope you'll choose Boston for training. And second, I'll echo Joel's point about applying to only programs where you are truly interested, and especially avoiding application bloat. This year, last year, I think all our programs saw a significant increase in applications, and that's not good for anyone. Thirdly, I'll say we're all, it's a very warm environment in our hospitals. We really care about you, and we really care about your careers. And I hope we could reflect that in today's session so far.
Thank you. And last but not least, Chris.
It's hard to follow such a great group of program directors and add much to what they had to say. I really enjoy everybody that you have on this call today. And so thank you guys. I really would agree with Jay, give Boston and Shiv, give Boston a try. It's a fantastic place. I agree with Rachel and Joel talked about the culture because it really is a culture, your place that's going to lift you up on those call days and help you grow and learn. I will say one very practical thing is that after you get to about 2 or 3 interview days, they start to jumble together a little bit. I tried to be very scientific. I had tables and charts and I had scoring mechanisms. At the end of the day, there's this gestalt that kind of comes out from it. And one of my former residents said that she used to leave a voicemail for herself after every interview day. And when she played back her voicemails, it was the excitement in her voice after interview day that told her which place to go to. And so find ways to do that. And the very last bit of advice is to have fun. I know there's a tremendous amount of anxiety in this process, but it's really quite fun to be able to meet new people on the interview trail, to talk to people, to think about where your career is about to go and that next step. So enjoy this opportunity. It's really a wonderful chance to create and write that next chapter in your career. So congratulations to you all for where you have gotten to this point.
Awesome. Thank you to everyone for your wonderful comments. I know that Jasmine is going to be putting up a poll that we'd love for you all to complete. And I also want to advertise that we do have some other upcoming sessions that we're going to put forward to help you all think about the specialty training that you're going to pursue. We have a series on pediatrics. We have a conversation on surgery, applying to MD PhD programs, if you know pre-medical students, as well as conversations related to emergency medicine, psychiatry, and a number of other specialties that we're going to be bringing on board. We have some contact information for some of our program directors and their Twitter handles, where you can see Dr. Bias in his soon-to-be starring role in a comedic / drama series. And also just be sure to check out our website for the DICP, where you can find more information, as well as you can see some prior webinars that we have posted available. I want to say thank you again to all of our panelists. Thank you to Dr. Reed for your continued leadership here in this space, and then also to Jasmine for your support as we have put together this series. And again, to the panelists, thank you for your time, and to the applicants, we look forward to seeing you through this application season. And we hope that you are here joining us in person for interviews. And if not, we hope to see you virtually through those interviews. And ultimately, we hope that you rank us highly and we are able to match you here in our residency programs. With that, everyone have a good rest of your day and enjoy the rest of the series that we have coming forward. Thank you.